Hello, everyone, and thank you so much for watching this video. This is Dr. Diego Garza, VP of Strategy and Innovation and Director of Telehealth at MindPath Care Centers. I was born and raised in Monterrey, Mexico, and then came to the United States 5 years ago to pursue a master's in public health at the University of North Carolina, and I have been heavily and happily involved with the Latino community since I got here. I am here today with Dr. Karen Melendez, a recognized psychiatrist in North Carolina, and Pilar Rocha-Goldberg, the CEO of the largest Latino nonprofit in the state. We're here to discuss mental health in the Latino communities during this pandemic, and I'm gonna let both of them introduce themselves, and then we can start this very important conversation.
Oh, thank you so much, Diego, for inviting us. My name is Karen Melendez. I'm a child and adolescent psychiatrist by training, born and raised in Los Angeles. From my mother actually came here as an illegal, undocumented immigrant when she was 17 years old. Basically, her purpose of coming here and why her family sent her was to send money back home and be able to have her younger brothers and sisters go ahead and continue their schooling and what have you. So came in, has been working as a live-in housekeeper, and something she still does to this day. Actually does very well in Bel Air and Beverly Hills and things like that, and places like that in Los Angeles. Actually remember living with her part of the time at one of her jobs, and she used to work for some pretty big names in the Hollywood industry. So I actually lived in El Salvador from the ages of 18 months to almost when I turned 5. So I actually experienced the Civil War in El Salvador. Actually, one of my earliest memories was dropping to the ground because my grandmother lived across from a police station, and they were having a shootout with the insurgents at the time. And so definitely saw my first dead body at age 4. Secondary to war and what have you, and I don't know if news in our countries is very, very different than what is shown here in the United States. So we are at, there's a lot of exposure to trauma and things very early on in our countries versus here in the United States, where many of the videos are edited in a different manner. So coming here, back here, and came to Hopkins in Baltimore, which was a very different perspective, where clearly there were some lines drawn along racial and socioeconomic patterns that is not true in California. I was grew up in a very multicultural area, had friends from all sorts of backgrounds, which completely changed when I came to the East Coast, and now I'm here in the South, which is a whole different dynamic as well. And so I'm a child and adolescent psychiatrist, medical director of Support Incorporated, which is just west of Charlotte, and we're a multidisciplinary agency providing all service levels for primarily children and adolescents, but we also see extended family members of the children we serve.
Perfect. Thank you, Karen.
Sure.
Thank you for sharing your story with us. Pilar?
Thank you, Diego, for inviting us here. I'm Pilar Rocha-Goldberg, and I was born in Colombia and I say Colombia, South America, because some people think it's South Carolina and think why my English is so bad. But I came here 16 years ago. I'm a nutritionist by training, and I came to work at Duke in research, looking at developing a program for hypertensive Latinos to improve their lifestyle in diet and exercise. So when I came here, I worked at Duke for around 5 years, but my task was, again, to develop this research program with the Latino community. So I started looking at how could I connect. I wasn't fully bilingual, and I knew nobody here, no Latinos here in Durham, North Carolina. So Googling, as everybody else, I found El Centro Hispano. And it's how I got connected with the organization, and it's how I got connected to the community. And while I was studying, doing my research study, the first time I visited El Centro, they were like, thank God, a nutritionist who speaks Spanish, because they didn't have one, or they could find bilingual, but not really bicultural nutritionists, so couldn't really relate to the community. So they started asking me to volunteer, give talks to the community about mainly nutrition, what I knew, because hypertension and diabetes and obesity are some of the things that affect our community here. So I started giving talks, and my first talk was about basic nutrition. There were like 25 women in the group, and while I was talking, people started laughing and whispering. So I asked, what is going on? I want to know what is going on. And they said, we don't understand you. We don't understand what you're saying. And even though I will speak Spanish, of course, we are so diverse within the Latino community that we use different names. And I know this is true for in the different countries too. So I had to start drawing, bringing pictures, and then understanding that if I wanted really to support the community, I needed to be aware of that and be able to communicate and be culturally appropriate to our community members. So throughout that, volunteering and learning more from the community, and also being in a place that the community trusts, and because they saw me so often, they started sharing their stories that I never heard living in Colombia. And then I decided I need to do more. So I continue volunteering more, and then throughout the years I became the CEO of El Centro 11 years ago. My God, time goes fast. And what we do mainly is supporting the community, strengthening the community, building bridges with different partners, the stakeholders and other organizations, but also advocating for equity and inclusion for our community. And we work in the Triangle area. We have offices in Durham, in Raleigh, and in Scarborough, Chapel Hill, covering the 3 counties, Wake, Orange, and Durham. We have four departments: education, community engagement and advocacy, health and well-being, and economic development. And we try to have a holistic approach to support the community and to accomplish our mission. And we see around 7,000 people per year with our different programs.
Thank you, Pilar. I think you brought up a very important point, both of you did, how we are known as a Latino community, but inside that Latino community, there's so much diversity. Like, we're so different from each other. The 3 of us are representing 3 different countries that might as well have nothing in common other than being Latino, right? So it's pretty complicated to be able to engage and even to define us as one community when there's so many different things happening at the same time inside that community. I wanted to start by giving the audience a summary of the reason why we're here today to discuss this topic, why the Latino communities have been disproportionately affected by this COVID-19 coronavirus, by this pandemic. So at a national level, I keep hearing the conversation that the Latino communities and other minorities are having to decide between being exposed to the virus or getting a paycheck, right? So that is the main question they're asking themselves every day. So national estimates say that the Latinos are 20 times as likely as other patients to have COVID-19. Effects are being seen in both immigrant and Latinos from multi-generational families. So that maybe points us to say it might have a cultural component, right? The reason why we're being disproportionately affected. There are different states, and just to give an example, Iowa, Florida. In Iowa, Latinos account for more than 20% of the coronavirus cases, but they are only 6% of the total state population. In Florida, Latinos represent 1/4 of the population, but account for 2 to 3 out of every 5 cases of coronavirus where the ethnicity is known. So this might be even higher, right? Because we're now collecting all the data. That's kind of a national level. At a state level, in the state of North Carolina, more than 4,000 Latinos have contracted COVID-19. Hispanics make up to 32% of the coronavirus cases, while only accounting for 10% of the state population. In Wake County and Durham, which are two of the biggest counties, Wake County, Hispanics make up to 10% of the population and 27 to 29% of the cases, of the COVID-19 cases. And in Durham, more than 50% of COVID-19 cases confirmed in the past 2 weeks have identified as Hispanic or Latino. So this is just to give us an idea of how disproportionately affected we're being. And I'm sure both of you have seen it. So I'm gonna go ahead and start with the first question that I have for both of you. And I'm gonna let Dr. Melendez respond first and then Pilar, just because that's the way we started in the beginning. So in your experience, what are the barriers that the Latino community faces when seeking access to mental health care services or other services for that matter?
Yeah, I think just in general, as far as services are concerned, I think sometimes there's just really that fear, right? Of especially when there are economic barriers, there might be legal barriers, and there's always just the concern of, if I'm told something bad, how am I going to manage it, right? Or if I actually reveal that I haven't been feeling well, will I not be let into work? And then, you know, what does that mean for my family? So I think there's just this tremendous amount of pressure, especially in the Latino community, to be okay. Just do the work, keep on going, face forward, and not really search out any additional help, right? I think we are on as the Latino community, we're under a very critical lens, especially in just the state that we're currently in politically and what have you. So we want to stay in our lane and not cause too many rips and ruffles and things like that. And I think that influences how much help we go out and get. In addition, traditionally in our countries, mental health is not seen as a real thing, oftentimes, right? And so, you know, despite, in my own family, despite having attended years of schooling and I'm making a living at this, I'm helping people, I see folks all the time, there's still a question mark as to what I do. Is a psychiatrist a real doctor? Right? So I think there's multiple barriers there where, you know, I often have moms who are just like, yes, you know, my son, my daughter need help, but dad doesn't agree with, right? Or dad was the same way in school and he's now working, he got over it, right? So that's where we can see several barriers.
Yeah, and I completely agree with that. I think you were describing the exact way that I was raised in Mexico, born and raised in Mexico, right? So Pilar, what are your thoughts about this question?
Yeah, so yeah, about the barriers. But one of the things I think we need to acknowledge, and we need people to acknowledge, is that these health disparities existed before COVID and now are exacerbated. So it's not that, you know, this is happening now to our community. You know, we know, like, for sure, like in the States, only 30% of Hispanics have health insurance. So that makes access to health really difficult for our community. And I think that's one of the main barriers. Yes, first, having the resources to have a health insurance or health coverage, but also knowing the system. And that's what we see now, yes, is where should I go if I don't have the insurance? How much are they going to charge me for the consultation? So it's an economic barrier too. I think language is still a main barrier, mainly in our state. you know, I want to go and be able to communicate in my own language about what is happening. So it's different if I can talk in Spanish to my care provider, or with that interpreter is kind of not very comfortable for people. And I also think what the doctor mentioned is, you know, the legal issues and documentation and the fear, people giving the information and what is going to happen with that information. And now with the public charge and all of that, is also people are very scared and very skeptical to give their information, because is it going to be shared, and what is going to happen to me? So I think those are the barriers we see for people seeking healthcare.
Yeah, and I mean, I think I agree with everything both of you have said. And I was trying to do an exercise here where I classify the barriers, but there's so many barriers. You guys mentioned education, access, economic, language barrier, fear, political, family, traditions. There's so many barriers, and it makes it super complicated to just come up with one strategy to really help the Latino population. So I think that the work you're doing, Pilar, the work you're doing, Dr. Karen, is very important, because all of us play a role, and it's almost impossible to attack all of them at the same time. But if we do little by little, we might be able to make an actual change in the environment. Y quería, hablando acerca de cómo fuimos, cómo me educaron a mí de pequeño, quería darles un ejemplo de mi familia. Mi madre sufre de problemas de salud mental, y siempre fue un secreto a voces, ¿no? Nadie lo hablaba, nadie lo atacaba, ella recibió atención psiquiátrica con un psiquiatra particular desde que yo me acuerdo, pero era como algo prohibido. No lo hables, no lo discutas. Si no lo discutes, no existe. Y si no existe, no es un problema, ¿verdad? Entonces, no fue hasta que yo me involucré en la medicina y en la salud pública, y ahora en el área de la salud mental, que realmente empecé a ver un cambio en mi familia, en cómo mi familia pasó de la salud mental no es un problema a la salud mental es súper importante. Pero tengo 33 años, me tomó 33 años llevarlos a ese punto, ¿verdad? Entonces, I can only imagine how other people are going through it without having the expertise in their own homes, right? The next question that I have for both of you is, and I think we've addressed this a little bit already, but it's good if we can go into more depth. In your experience, is the Latino culture an inviting environment for people who are seeking mental health and behavioral health services? What have you seen with the people that you are helping daily? Dr. Melendez, has your practice changed in any way? What are you seeing?
I think overall, just as I'm seeing in my English-speaking community, it's that overall stress of the children being home all the time and having to do schooling, and now, you know, parents now taking on the teacher role too, and also the childcare, right? Choosing how can we navigate still going to work and needing this childcare during the day, and how do we balance all that out? I mean, I think the beautiful thing about our community is there's usually plenty of extended family members around to be able to draw from and pull from. And so that, you know, makes for multi-generational households, which can bring their own stressors, right, into the picture. And is not as accepted, I think, by mainstream culture as far as this idea of a multi-generational house, right? Yeah. But you know, one of the things I always get is Latino family members, they're always in each other's business. And that is true. It comes from a place of love, though. You know, you have to remember that, right?
Yeah.
But I think, you know, just in this pandemic with COVID, I think everything, just like Pilar said, it's always been there. The struggles and the stress has always been there. It's just now unmasked and just more apparent.
Exactly. Pilar, what are you seeing in the community that you're helping every day? How have things changed for them?
Yeah, so I guess the first thing we saw was people started starting getting out of work, of jobs, because the line of work they do, mainly in cleaning and restaurants. So they were calling because they didn't have food to put on the table. So that was the first thing that added to that level of stress. And then now we are seeing, of course, issues about how am I going to pay the rent or the utilities, and what is going to happen when everything comes back. Are they going to take us again for work? The other thing we are seeing is a lot of, again, how am I getting the information? What am I getting? So we get people calling, oh, I'm trying to keep my family safe, as everybody's saying, cover my nose and my mouth and everything, but my neighbors, they think I'm crazy. They are telling me not to listen more to the news because I'm getting, brainwashed, and this is not real, and as a Latinos, we won't get it, don't worry, you're extreme. So that fear, and also from people who have been sick because COVID, some of the family members even, or friends, are saying, no, you're exaggerating, you didn't get it, you're only doing it to call attention, so don't tell us that. And also the stigma from other people. So if you were in touch with somebody who had COVID, now get away from me, I don't want to see you close by, or even if you're already recovered. So it's a lot of stress. And also we've heard stories of people saying, I don't want to go get tested because if I go and I'm sick, they will put me on a respirator. So it's all these, I think we go back to the barriers, really understanding the information, what is true, what do I really need to do to be able. So that's what we've been seeing in the community lately. And some people even call El Centro just to say, I just need to talk to somebody and affirm what I feel, what I believe. No, they don't call because they need anything, just somebody to listen to them.
And Pilar, I have often found that education, when given from someone with your own cultural background, has much greater effect than when just fed through the media or fed through someone that doesn't understand your culture, your language, things like that. Have you found that people walk away from conversations with you or your staff with a greater sense of understanding than if they were to call a general North Carolina hotline, which there is a COVID hotline staffed by nurse care managers, willing to educate, willing to give guidance? What do you think about that? Do you get a different conversation?
No, definitely it's a different conversation. And even sometimes lately we've been trying to bring also other community members, because sometimes they also get, like, oh, it's always Pilar telling us, or it's always Antonio, the same people. Or you don't know because you're not in the same situation as we are. So what we are trying to do is also to have, leaders within the same communities. And now we are like training health promoters from the community so they can go out. And it's different if my neighbor, who is in my same situation somehow, is telling me this, because, she got the information and now she's kind of translating it to my own, the way I understand it. So definitely that makes a huge difference. And again, when I was saying, and it happens to me too, if I want to go to the doctor, I feel more comfortable sharing some of the things in my own language, because sometimes I can't even find the words to describe what I'm feeling or what happened to me. Like 1 week ago, I fell and hurt my elbow. And finally, I had to go to the doctor to check it out. And I asked my husband, can you come with me? Because I don't think I will be able to explain exactly what happened and what I feel. So I think it's true for everybody, and more so for our community when it's another total different environment. So I definitely believe that that's very important to have people you can relate to, so you can trust. I think trust is very important.
Yeah, and I have seen, Karen, the work that El Centro Hispano is putting out, and how they are trying to really connect with the population and tell them, like, this is what's true and this is what's not true, and this is the resources that we have available to help you. So I think they have done a great job, Pilar. I congratulate you on that. I think it has been pretty amazing to see. So in the face of COVID-19, I mean, I feel like we've been talking about the same thing over and over, but there's still so many things that we haven't covered. But in North Carolina, why are we being disproportionately affected, the Latino community?
Well, I think that for the most part, we have jobs that expose us to a lot of people, right? Whether it be an agricultural job, whether it be a factory job, a meat packing plant, anything like that, right? In addition, we're also for the most part, coming home to a lot of people as well. It was 7 of us in a 1-bedroom apartment until I was 14 in LA. So it's very hard to practice social distancing, even when you have a common cold. Everyone's going to eventually get it. 7 days later, someone else is going to get it. I experience it in my own household now with my 3 sons. I have a kindergartner, a high schooler, and a grown adult son. And if one of them gets sick, sure enough, the rest of us will too. It's just right now, I think that's, the state of our community. And we can't stay away from each other, right? Culturally, we're a very loving social gathering that is, we don't stay away from family. That is, just inherent in our culture, large family gatherings and what have you. So I think that has to do a lot with the economic pressures, the type of jobs that we usually hold, and also just the multi-generational households that we live in.
Yeah. Pilar?
Yeah, I totally agree with that. And actually this morning we were in a meeting with the health department director here in Durham County, and he was sharing all the statistics, and the majority of the Latinos affected in Durham County by COVID worked in the construction sites. So that's what we are seeing. So definitely the line of work makes us more vulnerable. It's a difficult word for me. Vulnerable.
Vulnerable.
And also, I think the pre-existing conditions, like diabetes, obesity, hypertension. But also, I think part of the cultural piece, I was having a conversation with some people from the community, and one of them said, a lot of our community members feel, I'm not going to get it. We won't get it because we are Latinos, and mainly men, we won't get it. This is not something I will get. And also using the masks, we've seen that's another thing, it's difficult to separate ourselves, to distance ourselves, but also we are not using the proper equipment. So it's also, why do I need to use it? It looks a little funny. Some people feel it's like, oh, that's for, like bozales. I don't know how you call bozales in English. So I feel like a horse or a dog. I'm not going to bite anybody. So it's a lot of the cultural pieces too that are affecting the community. So it's, I think those are mainly the things we need to, but also the other thing we've been hearing is where do you get the masks? Yes. If our surgical masks are difficult, even if you have those, you're telling them, don't use them all day, don't share it. So you have to dispose them. So then what am I going, or where am I getting the masks? So I think that's also the other point we are seeing why we are seeing more COVID cases in Latinos.
Yeah, I think that's correct, and I agree with everything you've said. I'm while doing research on how we are being disproportionately affected, and if you Google it, New York Times, the Boston Globe, every major newspaper or news organization has written an article regarding the disproportionately way we're being affected by it. And in one of those articles, I read something that said that states are now citing longstanding social and health inequities as a reason why they are having to prioritize Latinos and other minorities in the way they are testing and conducting those tests. So beforehand, it was like this is a general approach for the general population, but now they're having to design strategies that take us into account as a main item in that strategy because we are being affected the most. So people are starting to pay attention. This has gotten national media coverage, and which is good. Sad at the same time that's happening, but good because we might be able to change the way Latinos are approached in this country and the way we as Latinos approach this type of services and pandemics in general. If you think about it, this might be the first pandemic that we have faced, but might not be the last one. So we might as well be prepared, right? So just to start doing some closing comments, I want both of you to give us recommendations on as a Latino member of the community, how do you think, and it doesn't have to be recommendations for the one specific member, us as experts, what do you think us experts should be doing? And then give me, or try to give us some recommendations on what the individual Latino member should be doing.
I think as experts, I think we need to rally as far as across the board, really finding the Latino physicians, the Latino community leaders, and forums such as this, right? Providing general education, whether it's through our churches, our other community forums, where Spanish television, where we're really putting the message out there the same way as, all of a sudden when a celebrity says it, it's true. I think we need to find a similar way to present the information, and that this is not, some government conspiracy happening and what have you, that this is real, this is honest, this is true, and that people are facing severe health complications, death, and long-standing illnesses and chronic conditions put you at more susceptibility for this, right?
Yeah.
And anything you can do, if not for yourself only, put on a mask for your child, right? Because the possibility of your child surviving COVID, yes, but we now have this whole post-inflammatory syndrome that has been documented across at least 20 states. So you don't want to be that one to bring that home, right? And living with the consequence of that and the guilt of that, right? So you may be healthy as an ox and could conquer it and what have you, but you don't know about your whether your family member will also have the same result.
Yeah, and I think that's very important. It's a matter of I'm not only doing it for myself, but I'm doing it for my family and for my community. I think that's part of the message that we should be selling. Pilar, do you have any comments on that?
Yeah, so I think we need to tackle on that family piece because we are very family oriented. But I also think we need to continue talking to the community and listening to them, but not only listening, also asking for solutions or recommendations from the community. So it will be, if you own it, it's easier to follow. So I think that's one of the pieces. The communication piece that you talk about, I think is very important. And actually, we are trying to here to get together with the community, with the communication Spanish outlets, to see if we can unify the information we are giving and targeting different sectors of our own community, the line of work, different line of work, because it's easy to say for the construction workers, yes, use the mask, but you're not all day in this weather now that is very humid and everything, wearing a mask and doing hard work. So how are we really doing this, and how we can gather the information from them, asking for solutions and communicate better with the community? I think those are the things that we've been trying to do, and I recommend people to do, and definitely form groups, as you said, Doctor, guiding the community, and better if our Latino doctors, because again, you see yourself reflected on that. So I think that's also very important.
Yeah, thank you. I think that us as experts and as members of the community, I think we ought to find a way to try and expand healthcare coverage for our Latino population. Data and research shows that up to 25% of the Latinos are uninsured, and then out of the people that are insured, most of them are underinsured, so they don't qualify for a lot of services anyway. So we have to pay attention to that, and if we're really talking about equity, health equity, we have to give them access to the same services that other populations are getting access to. Easier said than done, but I think us have the capacity to lobby and really go talk to our the people in charge and say, this is what we need, and this is why, one of the reasons why we're being disproportionately affected. And the recommendation for the Latino community, in my case, is wash your hands, lávate las manos, practice social distancing, physical distancing as we call it now. Yo entiendo que es súper complicado para la comunidad latina practicar distanciamiento social, because the nature of what we do, of who we are, is I want to be with my family all day, every day, and that's how I was raised. But it's really important for us to understand that we might be putting them at risk by doing that. So try to practice physical distancing and keep finding new ways of staying connected with the population and the community. I want to invite the Latino community to reach out to the people, organizations that can help you. Support Inc. being one of them if you're struggling with mental health services, MindPath Care Centers being another one, and El Centro Hispano, if they don't have it, they will find it, and I can tell you that by experience. So please go ahead and reach out. Know that there are people that are fighting every day the good fight to try and help the Latino community, and we are going to keep doing it every day if possible. So I want to thank Dr. Karen Melendez and Pilar Rocha-Goldberg for joining us. And I hope we can make this a regular conversation. And if not only the three of us, invite more people and try to stay connected and see how is it that we're going to make a difference in the Latino community.
Thank you. Thank you, Diego.
Muchas gracias, Diego. Muchas gracias, Pilar. Mucho gusto conocerla. Okay.
Muchas gracias. Hablamos pronto. Gracias.
Vaya, adiós.
Bye.
Gracias.